Dr. Leah Cecil, and I am a family physician out of Beaumont Health System. I work at Beaumont Practice Clearwater Family Medicine, which is located out in Washington Township, Michigan. And I'm actually a Lake Orion resident myself. I've lived here for a little over 6 years, and I'm a very proud supporter of the community. So I'm here today to give you a presentation entitled, What Do All the Numbers Mean? And What to Ask Your Doctor. The purpose of our presentation today is to help patients better understand the results of common blood tests that your doctor may order for various reasons, such as for a screening exam as part of an annual wellness visit, or perhaps because you're having some symptoms of some kind and they want to look a little bit further into that. So today I'm hoping to cover several different types of blood tests. We're going to start with cholesterol, which is otherwise known as a complete lipid panel. Then we're going to go on to cover glucose, otherwise known as blood sugar, and also cover a test called the Hemoglobin A1C. And that's a specific test that we're now using more commonly to screen for diabetes. We're also going to cover thyroid function tests, hemoglobin and hematocrit, which is commonly used to screen for anemia. And then we're going to finish up with talking about kidney function, as well as talking about liver function. So we're going to start with cholesterol and understanding your levels of cholesterol. And this is a pretty big area where there's several blood tests that we're going to break down over the course of our presentation here. So when you receive a cholesterol panel at your physician's office, they often include 4 basic components. So we're going to break each one of these down individually and kind of let you know about how to interpret all of these results. So we're going to start with what's called HDL, and that also is known as your good cholesterol. So that's the cholesterol that we want around to help eliminate some of the bad cholesterol and lower your risk of cardiovascular disease. And then we're going to move on to the LDL, which is otherwise known as the bad cholesterol. That's the stuff that we'd rather not have around in our bloodstream. And then we're also going to hit on triglycerides, and then talk about how that all comes together in our total cholesterol. So before we even get into what each one of those mean, I'd like to also bring up who should be screened for elevated cholesterol. This is a common blood test that a lot of people get, but maybe you're wondering, is this a test that I need? Should I get this test? So as you can see there's some common risk factors that are associated with elevated cholesterol, and I'll go through each of those. So one is age. If you happen to be of the male gender, you're also at a little higher risk of that. Those who are obese or overweight are at also higher risk of elevated cholesterol. If you smoke or use tobacco products, also increases your risk. Patients with elevated blood pressure are at higher risk, and those with a family history as well. Specifically, if you have a family history of early cardiovascular disease, and that's defined if you have a male relative in your family that has a heart attack or a cardiac event less than age 55, or if you have a female relative in your family that has a cardiac event less than age 65. And most specifically, we're talking about first-degree relatives, which includes usually parents, brothers and sisters, but sometimes grandparents and other relatives can be important too, depending on your family history. So we like to screen patients for cholesterol because I ultimately want to identify those that are at higher risk of developing cardiovascular disease, especially at an early age, so we can work to prevent that. So in general, as far as the age criteria is concerned, the United States Preventative Services Task Force, which we as family doctors often follow guidelines from, recommend that most men over age 35 be screened for elevated cholesterol, and that men between ages 20 and 35 should consider getting screened if they're at higher risk, And that means that they are also potentially obese, using tobacco products, or have other health problems such as high blood pressure or that family history that we talked about. And women, the screening guidelines are a little bit more lax. Definitely women over age 45 who are at increased risk, there's a high recommendation that they also should be screened. And then women between ages 20 and 45 with increased risk factors should consider getting screened as well. And your doctor may identify other reasons that you should be screened at an early age too, so it's always something good to bring up at your next appointment. So going back to each component of the cholesterol, we're going to talk first about the HDL. So as I mentioned before, that's the good cholesterol. This is the stuff that we want to have around. And ideally in men, we like this number to be greater than 40. And in women, we like it to be even a little bit higher, greater than 50. But in general, the higher the better. And this number often goes along with family history specifically. So if you tend to be in a family that has a low risks of heart disease, people are generally very healthy, you might be blessed with good genes and just have a high HDL naturally, which is a great thing. But some people aren't quite so lucky. So what can we do if our HDL is on the low side? How can we increase that? So the first and major thing that they found to be helpful is to increase your exercise, specifically cardiovascular, cardio exercise. So things like running, swimming, things that get your heart rate up. The other thing that they found to be helpful is to increase our intake of omega-3 fatty acids. And specifically, those are the fatty acids that we find a lot in healthy fish, like salmon and mackerel. So increasing those in your diet can help. There's also omega-3 supplements that can sometimes be helpful too. That would be something to bring up with your physician if that would be something that would be recommended for you. And losing weight can also help with increasing your HDL. So moving on to the LDL, as we talked about, this is the bad cholesterol. And the normal level for this level is a little bit more difficult to give you a hard and fast number, I would say. Most laboratory values, including us at Beaumont, report that a number higher than 130 is considered abnormal. However, the normal level of LDL for you depends a lot about your other risk factors. For example, if you're a patient that has, say, diabetes, we really want your number to potentially be lower than, say, someone who is 25, healthy, and without other risk factors. So your doctor may consider starting medications even if you have an LDL that's lower than 130, say 110 if you have other chronic medical conditions, or if you're at known risk for cardiovascular disease. So how to lower this in general? It's a lot of the same things that we just talked about on the previous slide. Heart-healthy diet, lower fats in your diet, elevated good fats in your diet, and regular exercise, and especially quitting smoking can also be helpful too. So when you have this test done as part of general screening labs, or maybe because you've got another chronic condition like high blood pressure, your doctor may use what's called a cardiovascular risk calculator. This is sometimes referred to as a Framingham risk score as well. And that may help your doctor determine if you need medications to help lower your cholesterol. This calculator calculates your 10-year risk of having a cardiovascular event. And that comes back to the doctor as a percentage. So the calculator takes into account things like your cholesterol, your blood pressure, your age, your gender, and if you're a smoker. And basically your physician can put in those numbers into the calculator and determine what your risk of having a cardiovascular event is. If it's low, say 1%, 2% in the next 10 years, that's obviously good news. And you may be able to have a higher LDL than, say, someone who has a 20% risk factor of having cardiovascular event in the next 10 years. So you can work with your doctor to help determine if additional medications or lifestyle changes may be helpful for you. The next component of the lipid profile that we're going to talk about is triglycerides. And these are known as the fatty particles that are in your bloodstream generally come from eating extra calories in your diet that aren't metabolized into glucose and energy that we need. So the normal value in most laboratories, including at Beaumont, is less than 150. And basically, you know, this level, again, can be slightly higher than this, and still you could be not at a huge increased risk, but something to talk to your doctor about if your number comes back higher than 150. Often with those patients with a strong family history of high triglycerides may have a higher number, or if you have uncontrolled blood sugar, this can sometimes also raise this number as well. So again, you'll see a common theme here. If you do have some elevated triglycerides on your laboratory report, what can you do to lower them? Well, specifically, triglycerides are often respond very well to dietary changes, specifically eliminating a lot of simple carbs in your diet, so decreasing pastas, white breads, sweet type foods, sticking to more complex carbohydrates like whole wheat and those type of things, and exercise, of course, as well. And then again, it's a good thing if you do have an abnormal number in this department to talk to your doctor about whether or not medication may be needed and helpful for you. So in summary, in regards to the cholesterol, we talked about the HDL, we talked about the LDL, and the triglycerides. So your total cholesterol is made up of those components. And ideally, we want that total number to be less than 200. But it's important to look at the breakdown, because if most of your cholesterol is coming from the HDL or LDL, you could tolerate a higher level of total cholesterol and still could be considered to be in the healthy range. So again, in summary, the HDL we ideally want to be higher than 40 for men and higher than 50 for women, and this is what protects us against cardiovascular disease. The LDL, or bad cholesterol, we usually like less than 130, but again, this level kind of depends upon your risk factors. And we want it even lower than that if you have other comorbid conditions or if you've had a previous heart attack or stroke, say. And you may be able to tolerate having a higher level than that if you have limited risk factors. And the triglycerides, as I mentioned, the normal level for that is less than 150. So we're going to move on from here to talking about blood sugar. And this is our screening test that we commonly use to screen patients for diabetes. This is otherwise referred to as the blood glucose. The two are basically synonymous with one another. And so again, we're going to talk about who needs to be screened with blood sugar, who needs to be screened for diabetes. And that basically is, a lot of patients, as we talked about before, but specifically those that are overweight or obese, patients with a strong family history of diabetes. Most patients over 45, it's recommended that they get a blood sugar to check for diabetes. Patients that have high cholesterol, as we just talked about, or patients that have high blood pressure, it's recommended that they be screened. And patients with symptoms of diabetes that we'll cover what the symptoms are in just a moment. And the other people that may need to be screened potentially at a younger age are in some ethnic groups. We know that diabetes is more common in Native Americans, in Alaskan natives, African Americans, and Hispanic patients as well. And we care so much about this because the prevalence of diabetes has really continued to increase in the United States. It was estimated in the last statistics that were done in 2012 by the American Diabetes Association that about 9.3% of all Americans had diabetes, and that amount is continuing to increase. And the scary thing is that a lot of patients don't even know that they have diabetes, so this is an important screening test to talk about with your doctor. This slide here illustrates very well a lot of the symptoms of diabetes. A lot of these are pretty vague, but they do, but patients usually don't experience these until their symptoms or their blood sugar gets very high and the disease gets very advanced. So patients who have very elevated blood sugar may feel tired often, frequently urinate, You may notice a sudden weight loss that's sort of unexplained, poor wound healing. Men may experience some erectile dysfunctional issues. They may feel hungry often, very thirsty often. Sometimes there's some vision problems, numbness or tingling in the hands or feet, and recurrent vaginal infections, specifically yeast infections, is very common in women. But as I mentioned, most patients that are diagnosed with diabetes don't have usually any of these symptoms at the time that they're diagnosed, especially if they were screened fairly early in the disease process. So as I mentioned at the beginning of the talk, we're going to talk about a few different tests that are available to screen for diabetes. So you could do just a simple blood sugar or a blood glucose that basically tells us what your blood sugar is right at that moment in time. But as we all know, our blood sugar fluctuates throughout the day. So every time we eat, our blood sugar will go up. And first thing in the morning, it's going to be different than later in the day. So a test called the Hemoglobin A1C is a very common test that's used often now to diagnose diabetes as well. And we'll go into that a little bit later too. Your doctor may also recommend an oral glucose tolerance test. This isn't used as much in recent days because it's a little bit more difficult to obtain. So in this type of test, you have to drink a very sugary drink, and then they take your blood at the lab a certain time period afterwards. So sometimes an hour, sometimes 2 hours after that. It's typically a 2-hour test, and the whole point of that test is to see how much your blood sugar elevates after taking in a large amount of sugar. But this test is a little bit more cumbersome for patients to do, requires a little bit more time. And so the other 2 tests that I mentioned earlier have become a little bit more popular. So this table here kind of shows us what the normal is for each of these test values, and I'll go through each of these individually. So the first column that you'll see talks about the hemoglobin A1C, as I mentioned. And that basically gives us an average of what your blood sugar has been over the past 3 months. This test looks at the blood sugar that adheres to red blood cells. And because red blood cells have a lifespan of about 90 days, this can tell us what the average blood sugar has been over 3 months. And has become a very useful test, not only in following and tracking someone's diabetes progress, but also in diagnosing the disease as well. So your doctor may recommend this test if you're at higher risk. So a hemoglobin A1C of 6.5 or higher is considered diagnostic for diabetes. And you may be considered at risk or pre-diabetic if your number is between 5.7 and 6.4. And normal is around 5 or less than 5. The second column talks about fasting glucose, or just a glucose level. So specifically, this column is looking at taking your blood sugar, not just at any random time during the day, but specifically when you haven't had anything to eat for at least 8 to 12 hours. So if you get a blood level of 126 or higher on 2 separate occasions, that's considered also diagnostic for diabetes. And you can see there that 100 to 125 is considered a little bit abnormal, where we need to watch, and 99 or lower is considered normal for that test. And then on the right, you can see the results for the oral glucose tolerance test. So 2 hours after taking in a glucose load or a sugary drink, if your blood sugar is 200 or above, you would be considered diagnostic for diabetes. So typically, unless a hemoglobin A1C is done, your doctor would need to have blood sugars, usually on a couple different occasions, to be elevated to specifically diagnose you with diabetes. The exception to that rule would be if you had a random blood sugar done at a visit that was over 200, and you also had some of the symptoms earlier that we mentioned, such as frequent urination or feeling very thirsty. That would allow them to diagnose you with diabetes. So again, this is a very important test to discuss with your doctor, especially if you have the risk factors we mentioned earlier. We know that diabetes can, if untreated, can lead to cardiovascular disease, kidney disease, blindness, amputations of limbs secondary to infection, neuropathy, which is chronic nerve pain in the hands or feet, and could cause some serious problems. But if identified early and treated properly, either with dietary modifications and or medications, it can help you lead a longer, healthier life. So the next set of tests that we're going to talk about is thyroid function. And as many people know, the thyroid is the gland located in the middle of the neck area. It produces a hormone that influences every cell, tissue, and organ in the body. So it's very important. The test that is usually done to try to identify if there may be a thyroid problem going on is called the TSH. This is a measure of what's called thyroid stimulating hormone. And this is a hormone that's released from the pituitary gland. And that is a gland in the brain that secretes hormones. It tells the thyroid that it needs to produce more hormone. And if this level is elevated, this actually suggests hypothyroidism or low thyroid. And that basically means that the thyroid isn't producing enough hormone. So the pituitary is telling the thyroid gland, we need more thyroid hormone, and the gland isn't able to keep up. It's also possible to have the opposite problem, where a TSH is on the low side, and that indicates hyperthyroidism, which is where the thyroid is producing too much hormone for the body. So as a family doctor, I'm asked to, hey doc, can we check my thyroid level? I'm really concerned that I have a thyroid problem fairly often. And going over some of these symptoms, you'll probably see why. This illustration here talks a lot about the symptoms of hypothyroidism, or low thyroid, as we mentioned before. So just to summarize these briefly, this often have symptoms. Patients with hypothyroidism have symptoms of fatigue, constipation. They may notice dry skin or hair. Women may have irregular menstrual cycles. Patients may notice cold intolerance, where they feel cold often, and they may notice weight gain. But as you can see from these symptoms, they're all kind of vague, and they can be associated with a lot of other conditions, such as depression, just to give one example. So patients often may think that there's something going on with their thyroid, but there may not be. But it's still a good reason to bring up if you have some of these symptoms to your doctor, to make sure that that's not the reason why. Conversely, hyperthyroidism also has kind of what we'd consider to be the opposite of those symptoms. So patients where their thyroid is overactive may feel irritable, overly anxious or nervous often. They may notice muscle weakness. They may notice weight loss. Sometimes they have difficulty sleeping. They're restless. If the disease becomes very advanced, sometimes they get some protrusion in their eyes and have vision problems because of this. And this is often symptoms of hyperthyroidism. The most common reason for hyperthyroidism is a disease called Graves' disease, which is an autoimmune disorder that often runs in families. And the most common reason for hypothyroidism is called Hashimoto's thyroiditis, which again is an autoimmune disease and tends to run in families as well too. There's about 20 million Americans, they estimate, that have some sort of thyroid dysfunction. And potentially up to 50 or 60% of those people may be unaware of that. As we mentioned, some of the symptoms seem to be pretty vague and can be blamed on a lot of other medical issues. Women are a lot more likely, about 5 to 8 times more likely to develop thyroid issues. So we diagnose this a lot more in women. And most of the causes, we don't really know why that comes up, but it is sometimes associated in families, as I mentioned. So who should be screened for thyroid dysfunction? We touched a little bit on this already. But the United States Preventative Services Task Force really has found that there's insufficient evidence to recommend routine screening for this test. So it's not something that most doctors are including in their regular screening blood work. Let's say if you came in for a preventative visit or a physical. So who should be screened is primarily patients with symptoms, some of the symptoms that we already went over of either hyper or hypothyroidism. Sometimes patients with a strong family history of this also warrant screening. And the one thing I didn't include on the slide there too is that a lot of physicians will also screen pregnant women as well, because thyroid dysfunction, specifically hypothyroidism, in pregnant women can lead to miscarriage, sometimes preterm delivery, and sometimes developmental problems in children if there isn't enough thyroid hormone during pregnancy. So that may be the other group that's screened as well. So what's considered normal for thyroid? So let's say you had some symptoms, let's say you had some fatigue, and some weight gain, and you had asked your doctor, maybe it's my thyroid that's causing this. Your doctor may order the TSH test that we talked about earlier. And there's a pretty wide range of normal for this test. So generally anywhere from 0.5 to 5 is considered normal. And if your TSH falls out of range, your doctor may recommend additional testing of specific thyroid hormones known as the T3 and T4. And these are hormones that are released from the thyroid, or potentially thyroid antibodies. These are things in blood that often indicate that maybe there is an autoimmune disorder, that your body is somehow attacking the thyroid and causing a problem there. So that may be additional testing that's added on after the TSH comes back abnormal for you. The next thing we'll talk about is hemoglobin and hematocrit. And this is the screening test we often use to screen patients for anemia, which is otherwise known as a low blood count. And a lot of patients come in and refer to low blood count as low iron, which is one reason why some people have a low blood count. As you can see there, iron deficiency is one of the causes, but there can be several other reasons for patients having a low blood count as well, such as blood loss, sometimes vitamin deficiencies such as vitamin B12 and folate, and other chronic diseases such as chronic kidney disease are other reasons why someone's blood count may be on the low side. So who should be screened for anemia? Who should be screened? This is a little bit more controversial than some of the blood tests we talked about earlier. It depends on which organization's guidelines you're looking at as to who should be screened. Certainly patients with symptoms, and most specifically, again, we're talking about fatigue, maybe pale skin, sometimes unexplained shortness of breath, maybe symptoms that patients should be screened. Most organizations recommend that pregnant women be screened because anemia during pregnancy is very common. A lot of physicians screen infants, usually between 6 and 12 months, because they're more likely to develop anemia, specifically from iron deficiency during that time. But again, that topic is a little controversial. And then menstruating females, specifically in the adolescent group, and young menstruating females, or certainly females that come in and say, I'm having very heavy menses, should probably have a hemoglobin done, at least periodically, to screen for anemia as well. So what is considered normal for this blood test? And this one varies a lot with age. So for the sake of time, I only really put the normal for adults on here. But if your child was also being screened for anemia, you could talk specifically with your doctor about what their normal range would be. So a hemoglobin basically measures the protein molecules in the red blood cells that are responsible for transporting oxygen to the blood. So for adult men, that number is generally between 13.6 and 17.7. For adult women, that number is generally between 12.1 and 15.1. So normal is a little bit lower for women. The hematocrit talks about the percentage of cells that are red blood cells, and that's generally between 38.8 to 50% in men, and 34.9 to 44.5% in women. So depending on your specific results, let's say you came back showing that you had an anemia, that your blood count was low, your hemoglobin was low, or hematocrit was low, your doctor would then, again, most likely recommend adding on some additional tests to determine the cause for that. So such as checking your iron, potentially checking a B12 or folate level in you, and recommend other screening tests, potentially such as a colonoscopy, to look and see if you're having some blood loss from some area. Next, we're going to hit quickly on kidney function, which is basically blood testing that's done to determine that the kidneys are functioning normally. And like some of the other tests we talked about, there's several tests that are done to determine what normal kidney function is. So we're going to break those down. So again, what's considered normal? So one of the tests that your doctor may order to screen for kidney function is called the serum creatinine level. And creatinine is a byproduct of muscle that's filtered out by the kidney. So we can tell how well the kidney is working by testing how much of the creatinine is left over in the body. And that number ranges anywhere from generally 0.8 to 1.4 in most laboratory values. Another value to look at is what's called the glomerular filtration rate, otherwise known as GFR. And that's not a test that's specifically done from blood, but it's a test that's calculated by the lab if you were to have kidney function done. And that basically takes into account your serum creatinine that we just mentioned, your age, gender, race, and some other factors that are calculated in there as well. And there's various stages of where this is considered normal. So the optimal range is to have this number greater than 90. However, greater than 60 is generally considered acceptable. And as clinicians, we don't get overly worried until a patient's GFR is less than 60 in most instances. Kidney function naturally declines with age. So this is a number that I would expect to be different for a younger patient versus an elderly patient. And we may consider even less than 60 to be fairly normal in an elderly patient. If your glomerular filtration rate comes back less than 60, especially if this is a chronic thing, you may have evidence of chronic kidney disease that your doctor may bring up to you. And the last test we'll hit on for kidney function is what's called the BUN, or that stands for the blood urea nitrogen. And that basically is a test similar to the creatinine that detects other waste levels in the blood. And can sometimes be one of the earlier signs of kidney disease. So the normal range for this test is anywhere from 7 to 20. And it, again, has a pretty wide range. Sometimes this test can be elevated, not chronically, but rather acutely. Say if you were dehydrated for a short period of time, your BUN may temporarily go up, and through rehydration, it may come back to normal pretty quickly. So again, as we touched on with all these other tests, who needs to be worried about kidney function? Who should be screened for this? So just like thyroid function that we talked about before, this isn't a test that we recommend that every person that walks into a doctor's office be screened for. We're specifically looking at kidney function more with people that have chronic medical conditions. Specifically, high blood pressure and diabetes are patients that we're most worried about. Your doctor may also recommend screening your kidney function if you're on certain medications or if they have other worries. But in general, this is not a test that every single person needs to have. So one less thing for you to worry about if you're otherwise healthy and doing well. So finally, the last test that I want to talk about is talking about liver function testing. And these tests are, like the kidney tests, are done to ensure that the liver is functioning normally. And again, just like the kidney test that we just talked about too, there's several tests that we can do to evaluate the liver function. So I'm going to break down some of the most common tests that you may have ordered by your doctor. So the first one is called the AST. And this test, or this component of blood is found both in liver and muscle and can range anywhere from 10 to 40 units per liter, or otherwise known as international units per liter. The ALT is found almost exclusively in liver, so it's a little bit more specific for the liver than the AST. And that range of normal is anywhere from 7 to 56 units per liter. And these are both, while the AST is also found in muscle too, they're generally liver enzymes, and we find that they will go up if the liver is damaged for some reason and can leak into the blood when there's a problem with the liver. But there are other reasons why these tests could become elevated. And the other most common test that's done by clinicians to look at the liver is called the alkaline phosphatase level. And this is an enzyme that's found both in liver and in bone as well too. So just like the AST, it's not completely specific just for the liver. So a high alkaline phosphatase level can indicate a blockage in the tubules that secrete bile from the liver. and can be elevated if there's somewhat of a blockage there. So sometimes people with gallbladder problems, say, will get a stone that will block the bile duct, and that may cause this number to become elevated. So again, this number has a very wide range as well too. So anywhere from 20 to 140 international units per liter is considered to be a normal level. And again, this test may be done for a variety of reasons. And we'll get into those in the next slide here. So who should be screened for liver function? And again, like kidney function and thyroid function that we talked about before, there's not there's not a reason to screen everyone that comes into the office for liver disease. So we specifically want to look at these laboratory tests in patients that are on certain medications that may be processed through the liver that can affect the liver function, patients with certain symptoms, patients with known liver disease, first of all, and then patients with certain symptoms such as abdominal pain, persistent nausea, and vomiting, or yellowing of the skin, otherwise known as jaundice. We'd want to look at somebody's liver function, obviously. And patients who consume a large amount of alcohol, also that is also processed through the liver, and so we would want to look at the liver function of those patients as well, too. I hope everyone found this presentation to be very helpful, and hopefully the next time that you have blood tests ordered by your doctor, you'll be armed with some information to help you interpret those results when they're sent to you. And again, I'm Dr. Leah Cecil, a family physician through Beaumont Health System, and I thank you again for your time.